You know, every month we're always happy to welcome one of the doctors with Center for Sports Medicine. This morning, we get to introduce you to one of their newest members. This is Dr. Ronald Mitchell, who is an orthopedic surgeon specializing in upper extremity. So that means your shoulder, I guess, arm and hand. Good to see you.
Yeah, thank you for having me. I appreciate it.
You know, typically when the doctors are here from Center for Sports Medicine, and I hesitate to say surgeons because not all of you are surgeons, we tend to jump in and talk about a specific focus in our conversation. I want to talk a little bit about you because you have been a surgeon in the Navy for a number of years.
Yes, I did. That's kind of how I started after residency. Yeah, I went active duty and then went out to Camp Lejeune in North Carolina. I worked with the Marines there, and yeah, had a wonderful experience there, and then also was stationed in Italy for 3 years.
So when you were in the Navy, you were a general surgeon, is that right?
General orthopedic surgery.
Okay, so then you begin this focus now on the upper extremity. So anybody who has ever had to have an issue with their shoulder addressed, the question always is, who's your surgeon? Because it's a lot of detail in there.
It is, yes, very complex joint. Yes.
Why? What makes the shoulder such a complex joint?
Just the amount of range of motion you have to be able to manipulate the upper extremity and all the planes of direction that it can.
Right.
So it just allows us to do so much more because of that complexity.
So when somebody comes to talk with you and they've had, let's say there has been an injury where surgery is going to be necessary, is it still a case-by-case basis on how you approach that surgery, or is there kind of a formula to it?
A little bit of both, and always seeing the combination of pathology and then how that's affecting their function, and then how we can optimize their outcome with either non-surgical or surgical treatment in that given setting.
So some people may come to you, and even though here you are prepared to go under the knife, so to speak, you might guide them toward a non-surgical approach?
Absolutely. I think it's prudent to begin with non-surgical most times. Sometimes in traumatic situations, you kind of have to kind of move forward with surgical recommendations, but often there's an opportunity for some non-surgical treatment that can get a lot of people better, improve function without surgery. But then, of course, we have that option if those things aren't as effective as we'd like them to be.
Talk to me a little bit about the elbow. That's also a very complicated joint, is it not?
It is. It is. Not as commonly injured, but definitely it affects the entire upper extremity. A really important joint to care for. And combinations of trauma or tendinitis often can affect people that really can be a painful type of limiting condition that we really try to improve.
Yeah, so I know one of the things you really enjoy about your work is that relationship building that you have with your patients. You want to kind of know who they are and what their expectations are post-surgery, right?
Absolutely, yes. I think it's really important to know what people's goals are and how they're being currently limited, and then how we can improve that, how we can get them back to what they want to do, need to do.
Hand surgery, Dupuytren's disease runs in my family, so I see that a lot with one of my brothers and with my mom. And the surgery with that has come quite a long way, has it not?
Yes, there's been advances both in surgical and non-surgical options for that. There's a specific enzymatic injection that can be performed to help break up those cords even without surgery. It's quite effective in many cases and can avoid the large, more morbid surgeries that are sometimes still necessary, but it's another option that really has been a unique development.
So that's that non-surgical approach that you're talking about. If you have, we tend to think about, at least I did, when my kids were little, you break a finger and you think, oh, well, no big deal. Doesn't your hand have the most bones of any part of your body?
It's pretty complex, yes. A couple of forearm bones down to 8 carpal bones, and then extending out to the metacarpals, and then each finger has 3 separate bones, and each finger connecting to the metacarpal. So there's a lot of movement and a lot of abilities there that we like to maintain, because it is how we manipulate a lot of our world.
So if you don't have it addressed the right way, the residual effect could be a bad one for you down the road.
Definitely.
Okay. Yeah. I know part of what we talk about when your doctors are here is the physical therapy component that you bring to it at Center for Sports Medicine. So if somebody comes in and they have a surgery with you, Is it typical that they'll then go through physical therapy?
Yes, and thankfully we have an amazing team of therapists, and a lot of hand therapists are actually occupational therapists. It's a different terminology, but they are the ones that are really executing the important work after surgery to get the motion and the function back in the extremity that we've operated on. So it's an essential part of that team.
I've been talking about this as if it's an acute injury. Sometimes there's just been an ongoing problem that now needs to be addressed surgically.
Yes.
Do you find that the sooner you address that, the better for people? Like, is there an age limit where you want to try to get things done? Rotator cuff, for example. Do you want to do that sooner?
Yes, I think it's a combination of knowing when things are limiting and age, because sometimes, as long as we can maintain function, I think that's the most important aspect, even more so than age.
Yeah.
Because if we can maintain function, we continue to have options even as people age. They sometimes do change, so it is ideal to repair, say, the rotator cuff at a younger age. But then as people advance in age, we have other options that are now available, such as a reverse total shoulder arthroplasty that may move to that as people get older.
That's a bit easier.
It's still a good option, yes. So
I have to ask you, 30 seconds left. Here you are. You traveled the world, lived in Italy. Why Chattanooga? What brought you here?
Firstly, the people are wonderful. It's a warm, welcoming place. My wife and I really enjoyed it. We stopped through here a while ago and just dreamt, we'd really love to live there. And sure enough, here's a wonderful opportunity, an amazing practice with people that care about their patients, and we're just really blessed to be here.
Well, we are so glad that you had a chance to come our way today. His name is Dr. Ronald Mitchell. He's at Center for Sports Medicine and Orthopedics. Their main number there on McCauley is 624-2696. As always, sportmed.com to help you find a location closest to you. Great to meet you.
Great to meet you. Thank you for having me.